Give the call to the member for Tangney.
Thank you, Mr. Speaker. My question is to the Minister for Health. How is the Albanese Labor government helping Australians who are seeking treatment for melanoma?
Give the call to the Minister for Health and Ageing.
Oh, thank you, Mr. Speaker, and can I thank the member for Tangi for his question and for joining me at the Southlands Pharmacy in Willetton last month. We were able to talk about the fact, firstly, that he campaigned so hard at last year's election on a promise to deliver cheaper medicines, and secondly, that he has delivered on that promise. In July, we slashed the maximum price that pensioners and concession card holders would pay across a given year for their medicines by 25%. In September, we cut the price of more than 2,000 brands of medicine, putting $130 million back into the pockets of hard-working Australians. And in November, the Minister for Social Services gave access to the Seniors Health Card already to more than 10,000 self-funded retirees around the country. And, Mr. Speaker, as members of this House know, on the 1st of January, we delivered the biggest cut to the price of medicines in the 75-year history of the Pharmaceutical Benefits Scheme. Already, in just the first 2 months of operation of the new price, the price of 3.2 million scripts have come down, delivering $36 million in savings to hard-working Australians. Mr. Speaker, we are also working very, very hard to make sure that Australian patients have affordable access to the most modern, most cutting-edge medicines available anywhere in the world. Since July, we have made 65 new or amended listings to the PBS to cut the price of the most modern, most effective medicines from sometimes tens and tens of thousands of dollars just for one course of treatment to just $30. And, Mr. Speaker, last week I announced the expanded listing of Opdivo and Yervoy, particularly to be used as a combination therapy for recurrent stage 3 or stage 4 malignant melanoma. As members know, Australians tragically lead the world in melanoma diagnosis rates. I hear some interjections about melanoma diagnosis. I don't think that's particularly appropriate, because all members of this House know that Australia leads the world in melanoma diagnosis. And this new treatment that would otherwise cost patients more than $10,000 for a course of treatment now costs just $30, giving new hope to patients like Natalie. Natalie was diagnosed with melanoma when she was 23 weeks pregnant, and she had to delay her treatment to protect the health of her baby. And tragically, just 3 days after birth, she was advised that her cancer had spread. But now, with this new treatment, she's able to tell us that she has a bright future ahead. Mr. Speaker, cheaper medicines aren't just good for the hip pocket and the household budget, although they are that. They're also good for your health, and ultimately they save lives.